Commissioner Taylor. Here. Commissioner Spitz.
Oh, sorry, here.
Commissioner Powell. Commissioner Gingell.
Here.
Commissioner Loops.
Here.
You have quorum.
Thank you. Please join me in rising for the Pledge of Allegiance.
I pledge allegiance
To the flag
of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Our first order of business is approving the minutes from March 11th and March 18th, 2025.
So moved.
Second. Commissioner Spitz, thank you. Commissioner Gershenson. All in favor say aye.
Aye.
Opposed? Our minutes are approved. Next up is approving our agenda. I have a motion by Commissioner Taylor and support from Commissioner Spitz. And Commissioner Spitz has a
I
question.
do, thank you, Madam Chair. Just wondering, because when reviewing the details over the last couple of days, there was a whole section on the Sheriff's Department for the Marine contracts. Has that been removed?
I don't know that the budget was complete. Is that
Yeah, 'cause
right?
it was missing data, that's why I'm asking, because the contract itself wasn't in there. So that was gonna be one of my questions. So is it the plan to be on the next agenda? Okay, thank you.
Do you want me to speak about it?
Sure.
Yeah.
What can you tell me?
We moved it to the next meeting. We still had some questions about some of the rates, and we're looking at them, and so we decided to move it to the next meeting.
All right, so the rates are still in discussion, is what?
Yes.
Thank you.
Anything else on the agenda? All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment. Is there anyone from the public wishing to comment on items on the agenda? You would come to the head of the table and state your name and community, and you have 3 minutes.
I'm April Ogg. I own Saginaw Street Consignments located at 150 North Saginaw Street, downtown Pontiac, and I live in Waterford. I'm here to speak on Agenda 8F, the Harm Reduction Center located at 148 North Saginaw Street, to make this board aware of issues that my business had since its opening. The clients are using my building alcove entrance as a waiting room, smoking cigarettes or joints, leaving their bags there or alcoholic beverages until they are able to enter the clinic or finish their appointments. I have videos of men on the bench in front of my building getting coffee to pour it out and fill it with liquor. I lost a client due to someone shooting up in their car. I have found used needles on the Lafayette property, including the dumpsters behind our buildings. Homeless people have slept waiting for the clinic to open, and some urinate in my alcove. Just last month, a man fired up a crack pipe that he received from the clinic in my alcove. I posted signs per the sheriff request, no soliciting, no smoking, but it doesn't matter, as I'm the bad guy now, getting yelled at throughout the last years, letting people know they can't smoke on my property. My entrance door sits 25 feet from the sidewalk, and so even when I try to go out and tell people that when they open the door, the smoke goes in, I get called foul names. I had employees scream in my face, "If you don't like homeless people, move your business." This occurred after a 911 call for a man that was in a wheelchair all day, pushed up to the entrance of the Lafayette Market, slumped over, unable to physically move himself. The clinic had pushed him there, which I didn't know. I only saw someone in need. I was told early on by the clinic's manager that it wasn't their responsibility for anything outside of the clinic. I reached out inquiring that if the clinic was permanent or will move. The clinic employees told their clients, and I received threatening phone calls. I filed a police report and put the man on no trespass. Since then, he has sat on the bench, and I've heard him badmouth my business to people and the police when I've called in regards to anyone drinking alcohol. When my father died in 2014 and my mom in 2017, the building could have been sold and I could have gone anywhere. Growing up in Pontiac, I chose to sell my house and put my equity into keeping my shop in Pontiac and help the downtown thrive. I'm not here to argue about what the clinic does. I'm standing here because in using tax dollars, outreach programs of any nature shouldn't harm or have a negative impact on the very businesses that pay taxes to support them. I was hoping Angela Powell would be here. As also a commissioner and liaison for Pontiac, I would expect more communication for any new projects and placement in the future in our C2 district zoning. Thank you.
Thank you. I believe this topic comes up later in our agenda, and sounds like there'll be a resolution for you, so some success. So thank you for coming.
Thank you.
Go ahead.
I think someone just had their
I agree.
sound on. We're gonna move to communications. There are a number of items under communications. The first are presentations regarding our ARPA reports. Do I need a motion for communications in the beginning or afterwards? Okay. All right, so let's move on to our first presentation regarding the project status and remaining balance from Health and Human Services. Is Shane online? Who's reporting on
Yeah,
this?
Shane is, I think he was just planning, since it was communications, to answer questions if anyone had anyone on the report. But we are here to answer questions if you have them.
Okay, thank you.
Read this.
Madam Chair, do you want a motion to receive and file the communications, and then if there's
Yes.
questions people can
Sure.
ask? So
Perfect.
I'll move that we receive and file the communications A through F.
Thank you. And I have support from Commissioner Erickson Galt. So all ARPA funding must be legally spent by December of 2026. However, departments have been directed by the Executive Office and Fiscal Services to ensure that all funding is fully spent by September of 2026 to allow time for closing programs out. So there are a number of programs under Health and Human Services. Does anybody have any questions regarding this report? Commissioner Spez?
Thank you, Madam Chair. It's not necessarily a question, it's probably more of a request, and specifically to the 80-page report from Stout on the Oakland County's Legal Aid Assistance and Housing Crisis Support Program, independent evaluation. Very detailed, very long. I probably should read it again because it's so long. Is there any way, and I don't know if this board is interested in this or not, that we can get them to come and give us a presentation on this? Because there's just so much data and so much information there. I think it's good for us to see it. I had 15, 20 questions while reading it, and I don't really want to go through them here. I'd rather have them come in separately to do a presentation if everybody in this board's interested. If not, I'll do a separate sit down with them, but it's just a request.
Sure, be happy to have that happen.
Thank you.
Commissioner Cabell?
I would like that too. Yeah, I had a couple questions about legal aid. One thing is critical home repair has a lot of money left. There's an explanation in the comments section, but just want to make sure we're pushing that money out to the community. So if anyone has a good answer, that would be good to hear. I guess Shane's here for that. Yeah, Shane, could you help talk more about why there's still money left?
So, Commissioner Bell, what I'm hearing is you want assurance that money is going out to the community. And my understanding is, they are signing contracts and they have at least half the number of the project that they're expecting to do in the works. And so it's in progress, it's happening, and money's definitely going out to the community. I understand from the Neighborhood Housing Development Division. I'm not sure how much more.
Okay, as long as it's going as planned, I see that it's right, payments partway through, so that makes sense. Just want to make sure. Okay, thanks.
I have one follow-up, just so this project got a really late start, so that's why you're probably seeing it take a little bit longer. But it does have a lot of traction and it is moving pretty fast, so.
Thank you. Any other questions regarding this communication item under 7A? All right, we'll move on to our youth assistance report, and we have Liz Sismedia here to talk about this. Do you want to come to the front of the table?
Sure. Good morning, thanks for having me. Back in 2021, under my predecessor, Mary Schusterbauer, Youth Assistance had the good fortune to receive a ARPA grant for $50,000. In 2022, Mary had retired and I took over the position as Chief of Youth Assistance. Had multiple conversations with Commissioner Lubes, who had offered the grant for $500,000. And I'll be honest, I was very concerned about our ability to pay that down in 2026, but I'm excited to report out that we are well on our way to spending every dime of that grant. In fact, I think we're ahead of schedule. It was the Oakland County Youth Assistance Coordinating Council who is the fiduciary of those funds. They've been very purposeful and intentional in allocating kind of an annual budget on the $500,000 that we had received back in 2022. Money has been earmarked for emergency needs, local programming development, and training and resources to kind of share some equity amongst all of the 26 offices just in terms of resources and tools when helping with our caseload families. To date, we've spent about $309,900 of the original $550,000. We have a balance roughly of about $240,100. 316 families have been impacted, and those families come from caseloads that are youth assistants on official court, juvenile court probation, and our reentry specialists also have the ability to access those funds. Anywhere from housing to mental health supports to car repairs. It should be noted that housing is a critical issue impacting our kids and families living in hotels, homeless families. Some of these funds have been able to provide first month's rent and security deposits to provide stability to our kids and families. So local programming, we are doing things like developing alternative mentoring programs, developing and implementing programs to offset academic needs, Girls Stand Strong, yoga, mindfulness, obviously with the uptick in kids that are impacted by mental health and anxiety coming out of COVID. So our local programs are being able to take advantage of some of these funds and obviously impacting more kids and families on a local level, with prevention obviously being the cornerstone of who we are and what we do. So $240,000 is our balance. I do believe, honestly, we will have gone through those dollars well before. It sounds like September is what you're looking for. I would imagine by next summer those pennies and dollars are going to be spent. But I'm more than happy to answer any questions or give you more information in terms of some of the things that we're doing with this money, which honestly is shocking and surprising, and it's wonderful. So I really do appreciate this gift and this opportunity to make the impact that our staff are able to do.
You mentioned alternative mentoring programs, so I understand the Mentor Plus program doesn't have staff for that. So what are the alternative mentoring programs?
These are, Bucket of Love, for example, is our program in Waterford. We have Silver Linings, very similar, the program in Novi, and then Oxford just developed and implemented a program called the Wildcat Cub Club program. And creatively, our volunteers and our local boards in those communities have reached out to senior community centers, have identified individuals who are interested in mentoring, and then training them, providing them with tools and resources. In the case of Bucket of Love, these volunteers get buckets, and they've got Uno cards, they've got activity sheets. The idea is not to provide any academic support for these mentors who were then assigned to kids that have been identified by teachers or counselors or social workers in those buildings where they're at risk. They need a mentor, they need that trusted adult in the building to keep them in school, engaged with school. So our mentors go into the elementary schools and spend an hour or two a week with these kids. It's winner. It's great for the senior population, and it's great for these kids. So it's held over during the course of the school year. In the case of Waterford, I do realize I think around the holidays, or there's seasonal activities and field trips where they all can kind of get together, go to the nature center, go to the water park, what have you. So those are kind of creeping up across the county, which I'm excited for until we can find some stability. Staffing is an issue with, but we're doing the best that we can with high caseloads and need to meet the needs of the kids that are in the community. So it's a program that's not gone away. There are some active mentors, I want you to know that. I'm just not in the business right now of recruiting and training new mentors right now.
So the individual caseworkers in the communities are responsible for gathering their mentors or overseeing the mentors and
Currently, yes.
I've been with youth assistants as a chair for years and years, and that's the way it was originally, till the Mentors Plus program came under the umbrella of the Oakland County Youth Coordinating Council.
And the reason for that ultimately falls on general liability insurance. What we were finding is that there were some inconsistencies from one office to the next. And because each youth assistance office is different, the caseloads look different, the volunteer base looks different, budgets look different, we needed continuity. And there's a rider that enables us to have coverage in the event that there is any inappropriate contact between volunteers and or kids, and that has not happened. But we need the insurance to cover that, and unfortunately the local offices just would not be able to afford the general liability insurance. So for consistency, for structure, for safety, it did come under the umbrella with a coordinator assigned to central office.
All right, thank you. Any other questions regarding this report? Commissioner Cavell?
Thank you, Chair. In your report, you talked about serving, I guess, how many people do you serve in a year?
Caseload kids?
Yes.
Roughly 2,500 kids.
Okay.
And families.
And then when I did some back of the envelope math, the money you got for these 88 families, or the money you used for these 88 families and these 262 families was about $500-ish to support them. This is part of, those $500 were ish for each family was for their emergency needs using the ARPA?
We're using funds, I'm not sure I understand your question, and I'm not familiar with what you have in front of you, to be honest, but
Okay.
Emergency needs is subjective. Our committee at the time sort of put a cap of $1,500 per request. But we've exceeded that in some situations and we've come in far less than that. It's subjective, it's based on the needs of what the family needs, and the committee will review accordingly.
And so when, out of the 2,500 families you serve, roughly-ish, how many have emergency needs that you've been able to fill? And what do you do when you run out of the money in the summer or the fall?
So while the 2,500 families may be eligible to receive emergency needs by sheer, because they're involved with the court, they qualify for those ARPA dollars, is what I've been told, and that's how we've been operating. To date, I have 316 families that have received ARPA emergency needs supports. The majority do come from the youth assistance casework staff in the local 26 offices or throughout the 26 offices, but juvenile probation has made requests on behalf of kids on their caseload. Children's Village reentry specialists have asked for some support on behalf of families. So I would say 80% of the 316 families are youth assistants, and then it breaks down to official court probation and Children's Village staff. So we get applications 2 or 3 times a week. I'm getting asks from the local department. In fact, we just had a training for local boards this past Wednesday, encouraging them to take advantage of the ARPA dollars to develop and implement programs, because I'm going to spend every dime of this program, of these funds. Our hope is that moving forward, the local offices fundraise, they get sponsorship dollars. Our hope is that this is sort of a springboard to maintain the local programs where they may not have been able to do so. And with success, hopefully success breeds success. Now, in terms of emergency needs, Youth Assistance has had the good fortune of being the recipient of a substantial gift, if you will, that's being managed through the foundation of, Community Foundation of Southeastern Michigan. So we're basically utilizing the interest off of that to maintain our emergency needs, hopefully the local programming moving forward, and training and resources. So we'll have the ability, the good news is that we just have the ability to do more quicker with this gift.
Okay, cool, thank you.
Thank you. Anything else? All right, thank you for the update on youth assistance.
Thank you.
Next up is the OSHA chore report. Heather and Marie here. Looks like out of our communities that are working with OSHA and our chore program, we have about 75,000 left, but sounds like that remaining money will be spent also by the time this program ends. So Heather or Marie, do you want to say anything about this program?
Good morning, everyone. I want to thank you for inviting Heather and I to your presentation. I've got a PowerPoint to share, which goes over the history and where we are and what our highlights. I'm the program manager at OSA, and then here's our division director. So I'm going to, with your approval, I'm going to switch over to PowerPoint and go through our slides.
Thank you.
So,
Make that full screen.
as I said, welcome. OSA is one of a network of over 1,000 community action agencies in the country. We were started in 1964 as part of Lyndon Johnson's War on Poverty. The county commissioners realized that there was a need for chore services. The county had not had a chore provider since 2019 when it received Older Americans Act funding. Now, a few of the communities had been using general funds for CDBG dollars, but there was not widespread use of chore services for seniors. And it's very, very important due to many reasons. So recognizing the non-feasibility of a countywide program, the Oakland Commissioners, this body basically appropriated up to $3 million of the ARP fund through local fiscal recovery fund to create a how-to toolkit on serving chore programs, and that will link on the board, and to provide funding to the communities, villages, to operate their own pilot projects. So why also? We were selected because we had worked on doing first services from 1984 to 2019, and that gave us the experience and guidance needed to help the communities. So we started the process with the awards were going to be automatic, and the CVs were eligible for various ranges. We worked with Shane Beast, and with him we created a funding formula looking at the number of households that had members 65 older, number of households at 80% AMI, the number of 65-year-olds within the poverty level, and that provided the initial funding during the first two rounds. Then in the third round, we just looked up to people, to the communities that had the first two rounds, and said how much you could do. And from that, these are all of the cities and villages that we funded, and we allocated 87% of the funds so far. So of those funds that were allocated, as of December 31st, 330,172 has been spent. We have the next batch of reports due on April 10th, and I know with the snow we've had, we'll have a lot more of that money having been spent. There's still 75,000, a little bit more to be allocated. That will happen in the fourth round this summer. Now, if any of the communities that are still in the process of starting up decide they are not able to spend those funds will be added to the fourth round. The program timeline, we started in summer of 2024, and it'll go through July 30th, 2026. The first summer was mainly spent on communities working on assessments, creating application materials, determining contractor. But during the third quarter, 9 communities were able to offer services. That was 1st through September 30th of 2024. And then 13 communities were able to offer services in the fourth quarter, which was October 1st, 2024 through December 31st, 2024. So services by community. The following two slides are basically showing what the communities are planning to offer. So you can see what your community is offer. Most of them are doing the lawn mowing, yard cleanup, gutter cleaning, snow removal, and bush and tree trimming. Several of them are going to be doing minor repairs. And then we had 3 communities that just started their programs with snow removal. Madison Heights contracted with a company in December, but didn't get enough snow to plow until January. And then Waterford Township and the city of Pontiac both started their snow services in January. They had challenges to find a contractor, but they were able to finally get a contractor. They do plan on offering the other services as well. Now, there are 3 communities that are just getting started. City of Auburn Hills had a late start due to staffing issues, but this one, we start with the applications, and they'll be doing lawn mowing, and gutter cleaning, possibly gutter repair, which they currently under their city funds, and then bush trimming. The city of Eagle Harbor is still trying to get a contractor. They were one of the early communities that were funded. They're working with Waterford to see if they can share a contractor. And then the Village of Bingham Farms, originally had planned heavy cleanup, but the person that was running that left Bingham Farms, and now they're looking at a possible partnership with Next in Birmingham. The person in charge of Next is going to be back in the office on April 4th, and they'll be meeting shortly thereafter. Now, each of the communities was able to do what they felt was best for their community, based on needs assessment survey. So they're trying different things with the pilot test. Bloomfield Township, for example, they prepaid for snow removal for 25 houses to see if this would be cheaper for them in the long run, which they believed it would be. So that they got a per home rate based on length of the driveway between 75 and 150. And then if we had a very thorough winter, which I don't think they went over the 10, but they would get their best at 50%. So I'll know more about this after our April reports. Now we had several unexpected benefits. In Holly Township, for example, their code enforcement yard service contractor, Lion Enterprises, wanted to expand. And with this wonderful program, it's allowed him to expand his business. He's working with Holly Township. He's not only doing lawn mowing and snow removal, but yard cleanups and gutter cleaning, and he's really been able to expand his business. Another wonderful win for new businesses is in Rural Township. Residents wanted to start his business. And this program has allowed him to do so. And he's working with the Rural Township staff, and he is providing lawn mowing, snow removal, and several other services. And the residents down there report that having a person they recognize from the community coming to do services immediately puts them at ease. And this has really improved their lives. Now we have a bunch of different partnerships from the program. Holly Township partnered with Holly Village, so they're providing all of the residents with services under one contract. The city of Ferndale is partnering with Royal Township. They're working on jungle yard cleanups. called jungle yards is mutually overgrown yards of fire hazard. And both of the communities are working together on a regular basis to see how they can share equipment, contractors, and work close together. Then Waterford Township is partnering with their community coalition and the city of Amarillo partnering with Habitat for Humanity. And this May is the Rock and Rock event where they will really get into their minor home repair program using these dollars. The other cities that are doing minor home repairs and have applications in the process are Oak Park, Ferndale, Southwood, and Grove Township. And the repairs you see there are redoing porches and replacing furnaces, water heaters, plumbing. Basically, anything that in the future they might be able to do with CDBG funds. They're trying it out, seeing what the needs in their community are using this wonderful arbor process. Then heavy debris removal. The village of Franklin determined that that was their greatest need and not the traditional leaf and branch removal. One senior's yard had been turned into a junkyard. As you can see, this is what her yard looked like.
Seen this one before.
And this funding allowed them to get this cleaned up and remove over 80 cubic yards of debris, so that now her house looks like this, which has improved the neighborhood, improved her safety, just improved values of the homeowner, of the home, and minimized vermin. Now, the bush and tree trimming is important, and this is a thank you from one of the Hazel Park residents of 38 years. He wanted to just really thank everyone for this program, for the tree trimming. It really helped clean it up for his house and make it much safer because from branches that were carrying electricity. So I just wanted to share that thank you. Then we have some before and after shots. This is a city of Boston. You can see the bushes that overgrown, where animals and stuff could live there, and then boom. After it's trimmed, much nicer looking, less chance of having animals living there. Then in closing, I want to share this thank you from Oak Park daughter, who said that her mom has been in 75 years in Oak Park, and they really appreciate what the city did by raking and bagging her leaves, and it was just a wonderful surprise, and they're just very, very happy, and thanks to everyone. And
that was an amazing report. I'm impressed with all the work that's being done. Thank you. Commissioner Gershenson?
Thank you, Marie. Just as a reminder or a refresher to the commissioners, when we did the senior blueprint, the number one issue that we were told seniors needed was chore services. And there was nothing in place. OLSA had done it in the past, but that program was discontinued. So we developed an amazing partnership, Marie, and what you've done is incredible. My question is, so where do you go from here? When the ARPA money's gone, then what happens to these programs and the chore services?
Well, we structured it so that they would be able to transition to their community block grant funds. And then also all of the communities, when they signed up for the program, they verified that they would look for other sources of funding and get creative. So that some of them are starting with asking for donations. Some of the communities are planning to basically advertise in the community saying, hey, businesses, we have this wonderful program. Why don't you support it so that we can continue it after this pilot ends? So they are working with us to put different strategies to try to keep the programs going. Because even that they want to keep it going, if the pilot project was successful. So that we're optimistic that many of the communities will be able to continue it in one way or another.
So Marie, can you give us an update in a couple of months, in 3, 4, 5, 6 months, whatever you think, so we know how this program is, how it's continuing in communities and communities' needs? And I'd also like to see a more detailed budget. Can you get that over to our staff at some point?
When you say a more detailed budget, you want to know how much money was allocated to each community?
Yeah, I am curious about how that money was spent. The $3 million.
The allocate, you mean the allocations?
The $3 million, I'd like to see a breakdown of how it was spent.
Okay, well, I can provide you, what we have contracted for the different communities.
Yeah, that'd be great. That'd be great. Thank you.
You're welcome.
Any other questions or comments regarding the OSHA chore report? All right, thank you very much. Our next update is the ARPA Oakland Together School Mental Health and Wellbeing Communities and School Initiative Q2 reports. So these reports deal with the cities of Madison Heights, Ferndale, Oak Park, and Pontiac, and how they've spent their money with our students in life social skills, behavioral interventions, school supplies, clothing, hygiene products, family engagement, academic assistance, and food. Oh, Sarah, are you here to talk about this item?
Yes, I am.
Oh, perfect.
I'm with Community and Schools, and my colleague Julia Coffey is also here with me. So yeah, thank you so much for having us. Would we be able to screen share briefly? Not able to do that currently. I don't know if I can grant access.
Sure.
Okay.
All right, access granted.
Perfect. Oh, I didn't put it in present mode, but if that's okay, can you all see it all right?
Yes.
Okay, perfect. So, yes, good morning. Thank you so much for having both Julia and me here to share a little bit about communities and schools and the work we've been doing in these 4 communities in Oakland County. Just in case, I know that many people are probably already familiar, but this is a very, very brief refresher. Our mission is to surround students with community support, which empowers them to stay in school and achieve in life. And this is our North Star belief. We've been working in 10 schools in Oakland County. In large part, we were able to offset the cost of our services to those 10 schools thanks to the money that we received from Oakland County, and we look forward to continuing services. In the last few years, just as kind of an overview, CIS, we are an affiliate of a national organization. Our nonprofit 501c3 organization is the Michigan affiliate. We are in 72 schools across the state of Michigan, and 10 of those are the schools that we serve in Oakland County. And what we do in a nutshell is we implement a model of integrated student supports. So what that means is we place a full-time support coordinator in each school that we serve, and that student support coordinator implements our model. They do a needs assessment for each school, which involves talking with school administrators and staff, students, families, and the community at large to find out the strengths of the school, the existing partnerships, and then also any gaps that we can help fill in areas for improvement so that we can then bring in supports accordingly. We really pride ourselves on doing this needs assessment process so that we are not duplicating services and to make sure that everything we do aligns with the priorities of the district and the school itself. We then generate a school support plan based on the needs that we find, and then outline all the services and supports that we'll be bringing into the building throughout the year. And then from there, we implement that support plan throughout the year. Our services are organized into 3 tiers. So tier 1 is full school supports, and so that is a lot of what we do with bringing in basic needs items, full school assemblies, full school initiatives. Tier 2 is small group supports of case managed students. So that looks like mentoring groups, tutoring groups, lunch bunches, things like that, where it's small groups of students. And then tier 3 is one-on-one supports. So the student support coordinator in each school As a case of students, 35, 40 students, they work with more intensively and individually throughout the year. So in addition to providing whole school supports, they're also working with caseload students that they check in with monthly and help each of the students pursue individualized goal. Goal areas for both individual students and for the school are either in academics, attendance, or behavior. And we also work with students on these skills, of course, as all those things are connected when we're helping students work towards those goals. In terms of how we monitor and adjust throughout the year, we are extremely data-driven. We have an internal data management system that up your case notes on case management, support that's given, that's given out. We use that to really look at the data on a routine basis and see what's working, what's not, and then adjust quickly. At 3 working period, look at that data, look at data, and then adjust. And then at the end of the year, we're able to also use that data to evaluate our success and make plans for the following year. So in regards to how this applies directly in Oakland County, we've had the great joy and privilege of working in 3 schools in Pontiac, which are Pontiac High School, Pontiac Middle School, and then Walt Whitman Elementary. We also work in 3 schools in Unison, the elementary school, the high school, and then Winston Middle School. And we work in 5 schools in Ferndale. 4 of those are funded by Oakland County money, and 1 of them is funded separately. But the ones funded by Oakland County money have been Ferndale High School, Ferndale Middle School, Ferndale Upper Elementary, and then Ferndale Lower Elementary. And then in Oak Park, we are in the high school and middle school. Unfortunately, the money from the county is going to be done after this school year. We do plan to continue in hopefully all of those schools. We are having to find other sources of funding for that, which grant on our end. But we have had great success in those 10 schools and been super grateful for this opportunity. Through the money that Oakland County has given to us, it allowed us to really start those services, gain traction, build relationships with those school leaders, with the district leaders, and we hope to implement these services far into the future. That's our current plan in all 10 schools. So really at this point, we can share numbers. I know that Shane has also reports he can share out, but if anyone has any questions on what we do and how it's kind of been going, we'd love to answer any questions that you have.
Thank you. Are there any questions or comments? Commissioner Spitz?
Thank you, Madam Chair. Just one thing, can we get a copy of this? Because I don't believe it's in our packet, the presentation.
Yeah, sure. You can send me over this slide, and then if there's, I can send a few other resources as well.
Thank
I
you.
didn't want to take too much time because I know we're very busy in this meeting today, but I can definitely send those over.
Great.
Thank you. Anything else?
Nope.
All right, thank you.
Thank you so much.
Our next four items are items we regularly see under communications. We have our animal intake and disposition report for February of 2025. We have a grant application to the Michigan Association for Local Public Health for the 2025 Wellbeing Mini Grant, which is would address well-being for our employees. The next item is a grant application to the National Association of Counties for the Counties for Housing Solution Grant. So this would help counties with technical assistance to develop underutilized county-owned land as affordable housing. The last item under communications is a grant acceptance from the Michigan Department of Health and Human Services for the Family Engagement Program. Any questions on these items? All right, Commissioner Cavell.
I just wanted to lift up that the animal shelter, there are things that they were doing to change things are working, I think, because their numbers are down. They used to have like 300 dogs a month, and now they have like 170 or whatever.
Thank you. Commissioner Powell?
And then I'm just happy to see that we are moving forward with the Counties for Housing Solution Grant. I was kind of on the chair about us trying to do that because we know we have a lot of properties that we're trying to figure out what we gonna do with them with our capital improvement stuff. So I just thought that was good for us to try to get that assistance from NACO.
Right, thank you.
Yep.
Thank you. Anything else under communications? All right, we have a motion and a second to receive and file these reports. All in favor say aye.
Aye.
Opposed? Our communications are approved. We move on to Health and Human Services recommendations. We have a number of items under here. We have grant applications, grant acceptances, amendments, and a request for allocation of the opioid settlement funding. So we have,
Yeah, you can.
yes,
We have
a number of people to address, a number of issues.
tonight.
Would somebody like to make a motion regarding these items? I have a motion by Commissioner Powell, support from Commissioner Gertensen. So, welcome. Our first item is the grant application to the Michigan Department of Health and Human Services for the fiscal year 2025 in lieu of services Capacity Connect program.
Yeah, so this first ask is a grant request. We would like to submit an application. So unfortunately, we're hearing that a grant is ending, which is a common thing we're hearing now. And so what we'd like to continue is our Healthy Prescription for Health program. And the funding that we're not seeing in RFP come back out is for our employee that actually supports that program. And so this application will allow us to be able to continue to house that individual and help us work on the Prescription for Health program. The Prescription for Health programmatic money actually comes through a different source, but for somebody to actually work on the program and provide support is what we're hoping this application will help us with, so.
Thank you. Any questions regarding that item? All right, next, the grant acceptance from Metro Solutions for the 2025 Advancing Healthy First program.
Good morning, everyone. Leanne and I are going to just bounce
Yeah.
back and forth on these. You'll see it on the
Actually,
agenda.
we should probably introduce Kate Guzman because she hasn't been here yet.
I've been
so.
on the screen. I'm Kate Guzman. Good morning.
Yeah.
It's nice to see everyone.
Public
in
health
person.
officer.
Yeah, she's our new
Mornings.
So we were awarded $25,000 from MDHHS's Perinatal Quality Improvement Coalition, and it's specific. Our program will specifically focus on breastfeeding education and resources to clients, and education on miscarriage grief support to emergency rooms. That's a newer initiative which should provide the staff in the emergency rooms with the knowledge and some physical resources to help families that are grieving post miscarriage.
Thank you. And so this grant is $25,000.
$25,000.
Okay, now our next item is an amendment to the 2025 COVID Regional Health Equity Council Backbone Grant.
Yeah, so this is an additional $25,000. We've brought this grant a few times for amendments. And so this is just to increase our programmatic reach and help with data analysis. I will tell you, this is likely part of the $3.8 million that we're about to be cut. So we're waiting on official news from the state. It's coming likely this afternoon, the individual grant programs, but this was on the agenda prior to, and we'd like to still accept the money if it's there, but we are anticipating that this grant money will be cut, so.
Thank you. Our next item is another amendment to the interlocal agreement between Oakland County and Luce, Mackinac, Alger, Schoolcraft District Health Department.
This is a continuation of an interlocal agreement that we have with this health department, the Luce, Mackinac, Alger, and Schoolcraft, to support the training of new sanitarians because they don't have the number of restaurants that we do, simply stated. So we provide training support for them. There's no financial obligation in this.
Thank you. And the next item is an amendment to the Michigan Department of Health and Human Services fiscal year 2025 Local Health Department Comprehensive Agreement.
So yes, our comprehensive agreement is our large funding. It's not a big adjustment. We did lose $6,500 in an MPOX grant that wasn't continued, that was terminated. It was a mobile outreach for MPOX. We are receiving $117,000 extra for emergency preparedness. We'll be spending that on a little bit of staff salaries, fringes, and these cool telecom, they call it Pocket Talk for translation in the field. Our special ask is creation of a special revenue part-time dental hygienist. So we would be requesting to spend $69,445 on that to assist with our kindergarten oral health assessment program, which is a new required program for entry into school.
Thank you. Our next item, we'll have some conversation. It's the request for allocation of opioid settlement funding. And I would like to hear some more information about how we're addressing also the problematic behavior at Saginaw Street consignment.
So thank you so much for having us here. So first of all, I think last time we spoke about the opiate settlement committee was when we were setting it up. I really want to use this opportunity to appreciate your support in helping us stand up this committee and also help us hire our epidemiologist, Caitlin, who's with us, who has been doing an amazing job, not only providing us the data to create the right strategies, but also supporting all of the other groups that are adjacent to the opiate settlement committee that help us, such as our opiate fatality reviews. So I'm sorry, I'm not sick, it's just Mother Nature's mad at me today. As you all know, by the way, I'm Madiha Tariq. For anyone in the public, I'm the Deputy County Executive. I also sit as the chair of the Opiate Steering Committee, co-chaired by Leanne Stafford from our Health and Human Services and Public Services, Barb Hankey. The Opiate Settlement Committee's goal was to reduce the incidence of opiate overdose in our county, and also reduce the use, the addiction and use and misuse of opiates in our county. How many of you are impacted or know somebody or who has been impacted by addiction? Everyone. And I think it's really important to elevate that, because when we think about people struggling with addiction, it is everyone. We have seen, if you look at the data, we have seen high incidences in rural areas, urban areas, rich, poor, all demographics. There was a 256% increase in opiate overdose in the last in the last 7 years, right? So that shows us that this is an urgent matter for us to address. So last year, with your blessing, we were able to begin a 15-person steering committee that includes stakeholders, many of whom are here today, which shows you how committed they are to this process. So we've got folks from that represent the Sheriff's Office. We have Steve Norris here. Ken Briggs is also here. I know online under Jamie Clayton from Oakland Family Services. Amongst folks that are not here, we have 2 hospital systems represented. We have the Oakland schools, housing folks, mental health folks, and even representation from our unions are on this committee, because we know that this impacts everyone. The steering committee has so far, what they're working on is to develop a strategic plan for equitable distribution of opiate settlement funds, ensuring that we address this issue effectively. And then also to make sure we consistently stay informed on what the opiate crisis looks like. And we don't want to be the only ones to stay informed. We in fact have now a public site that's through our Oakland County website that gives you the latest data. It also showcases some of the strategies and conversations that have occurred thus far. I don't know if we've shared the website, but we'll make sure that that is shared with you all. And there's always an opportunity for us to keep an open mind when it comes to addressing the opiate crisis, because it can change dramatically, right? These federal funding cuts can impact how the opiate crisis changes locally too. Because if there's less housing resources, if there's less mental health resources, that could change who we're seeing through the doors. So just to summarize, what we've done thus far is establish the Opiate Settlement Committee. We have done listening sessions, which we talked about the last time we were here, across the county, especially in communities that have been highly impacted by overdose. And this also included conversations with the police chiefs and other community organizations that are stakeholders in this space. And then we've also reviewed data. We actually, one of the first things we did is we had Caitlin create a map and put basically dots on all the places that provide prevention, treatment, and resources around the opioid crisis. And we had about 300 dots on that map. So why are we seeing a 256% increase in overdose? What are we doing wrong? And then right now, we're in the process of finalizing key strategies that my colleagues are gonna share with you, because we wanna bring those back to you and start talking about the RFP or building process so we can engage the communities that are impacted. So with that, but there are some things that are happening right now that we need to address. And the reason why we're here with you right away is because if we don't fix these things right now, it's gonna overflow and overboil. And it will not help us make the right decision about what the opiate crisis, for the opiate crisis. So am I handing it off to you? Okay, Barb. So Barb is gonna give you a little bit summary of the strategies.
So thank you, Medea. Barb Hankey, Director of Public Services. And as Medea mentioned, through the committee, we've been looking at prioritization of what our key strategies are going to be. Now, in the federal settlement, there's a document called Exhibit E, which outlines core strategies or abatement strategies that recipients of settlement dollars are supposed to follow. And so we have been taking our sort of guidance from those core strategies. So the main 4 strategies that we have chosen to focus our attention on, the first one is staffing and infrastructure. And in listening to the ARPA conversation and what we learned from ARPA is that the question always is, and what happens when the money runs out? And so what we've picked the staffing and infrastructure, not to just give money to every agency, but rather how can we use the money we have to really support all of the agencies? What are the infrastructure that we need to build, and improvements to staffing and to help the field as an entirety to carry forward this work? The second thing was expansion of harm reduction strategies. We need to meet people where they're at and hopefully move them to a place of recovery and abstinence, but not everyone is always ready to do that. So we want to make sure that we're able to meet them where they're at. We want to have an expansion of warm handoffs and recovery services so that when people are ready, there's often a short window of when people say, I'm ready for treatment, and we need to take advantage of that and get them into the treatment, not just hand them a piece of paper or referral, but actually facilitate getting them into those recovery services. And the last one is the expansion of prevention services. We know we need to get out in front of this and to keep people from starting and to misuse or use opioids. And so that really starts with the prevention and education around opioids and the dangers of opioid use. So with that, I'll turn it over to Leanne.
And so the 3 things that we're asking for today that the committee has, asked us to come to is, one is a full-time nurse practitioner that sits in our harm reduction office. So what we would like to do is take an existing nursing position that we have in Health and Human Services and use opioid funding to increase that to an NP. And the reason we're doing that is a lot of the clients that come in may have medical needs in which they're not willing to go see an actual doctor or physician. And so when we try to train nurses, nurse practitioners, they can help treat small things like wounds, right? Where somebody, if they don't get action or help here, they're going to an ED or an emergency room, which, we don't want them in an ED, right? We want to try to help them where they are. Also, if they're ready to go to recovery, right, but they need medications for diabetes or other items, they can't go to treatment until they get those things taken care of. So this NP in our office can help those. We have 950 clients that trust the individuals that are coming to our downtown Pontiac location. So we're asking for that. So we're only asking for the additional increase to get to the MP. So Health and Human Services will take on the majority of that. The other thing we're looking to purchase is what's called FTIR. If someone can pronounce it, maybe Steve can pronounce it if I ask him. But basically what it is, it's a device that can detect the drugs in residual, right, either a syringe or a baggie in the field. So what we're not waiting for is someone to end up in the medical examiner's office to determine the chemicals and the drugs that are in the community. And so I love to use, recently we had a case in OFR, right, that they found a drug, right, that they had not seen much in Oakland County, but we discovered it in someone that was deceased. So if we had been able to test those drugs in the community, it allows our community partners like Steve and our wonderful partners to be out there really educating on what's going on, and even in our own offices. And so we're looking for, the machine would be actually located directly in our harm reduction office. Our staff would be trained to be able to provide the transfer and be able to test. And again, hopefully determining what's in the community prior to the medical examiners. And the last one is we're looking for a resource directory. I'm gonna turn this over, not to drop it on you, but you know the most about it.
So this goes to the infrastructure within the community. What we have heard, and we're working on a very similar project through ARPA dollars for the juvenile resource directory, is that there is no one source of truth. Individuals, many providers have these resource directories, but if a phone number changes or an eligibility changes or the services change, I might change that in my directory, but it's not changed in everyone else's. And so individuals are calling numbers and getting dead ends or realizing that they're not eligible. And after they do that 2 or 3 times, they stop calling. And so the idea behind this is it's a web-based, one source of truth that is updated, can be continually updated, is accessible to not only the general public, but providers, anyone in the field that would need to use it. And we're also working on a project where is looking at contracting with software, and this would be sort of the resources that would populate that software. So when people called, they could be given those resources, and again, they would be accurate and up to date and trustworthy.
And one thing to add to that is it's web-based. So not only would our clinicians have access to it, anyone around this table, the community, and our goal would also be is encouraging the community members to update their information. But we also would have access to do that. So it would be available to anyone to utilize, so.
I think one thing I'll say is that in 2023, our health department did a survey where mental health was identified as the most major, most urgent need in the community. And 1 in 3 people that identified struggling with mental health said that they could not seek services because they did not know where to go. So I'll bring back this visual image of 300 dots on our Oakland County map of treatment, recovery treatment and prevention options, but people still not being able to seek help. So we need to do a better job of figuring out what is going on. Is it because people don't know how to access these places? Is it because these places are crappy and we need to do quality control? Is it because maybe these places don't exist and they're just on the map? I think it is our job to have that collective responsibility to create a system that can keep our mental health response accountable to the need of the community.
Thank you. I would like to talk about the location of the harm reduction clinics. So the one specifically next to Saginaw Street Consignment. I know that the harm reduction lease is up in September with plans to move that clinic to the Honor Clinic site. So in lieu of moving the clinic earlier, and that would be dependent on Honor, how are we able to assist in Saginaw Street Consignment now with the behavior of people who visit the harm reduction clinic?
I think, I think we just have to, we have a plan to move anyway, because you heard 900 clients, right? We gotta find a place that's bigger. But at the same time, I think it's really important that we actively build a relationship with our small businesses, because knowing the extent of the need in the community, these issues are not gonna go away whether the downtown clinic is there or not. Some of the things we're doing in the community is creating more resources for homeless folks. So every Wednesday, some of you have been there, we have Wellness Wednesdays at Ballman Center that provides resources to our unhoused and housing insecure individuals. They can come every Wednesday, linked to housing resources, nursing, Oakland 80, schools. I mean, they're all there, and they can do their laundry and shower there as well. The other piece I'll also say is that I'm actually today going to the Main Street meeting at the end of the day today, to introduce myself and make sure that we have an open line of communication with the businesses. As a health and human services lead, we have to work hand in hand with our businesses, and it is our intention to start doing that. Maybe those conversations weren't happening at our level as much, and we want to make sure that we're there for them and accessible, and to all the businesses that are in downtown.
But what practical things can we do today that will eliminate the syringes on the ground, the people drinking in front of our store, the urination in the alcove? What can we do today and moving on until that clinic is moved?
Do you wanna?
Yeah,
Okay,
if
we
I may.
actually have somebody from the community.
I'll stand, it's okay. Good morning, everybody. Thank you, Madam Chair. My name is Steve Norris. I'm the Director of Overdose Prevention and Recovery Support at the Alliance of Coalition. I also serve with the Oakland County Sheriff Crisis Response Unit. And one of the practical things we can do immediately, and I had the pleasure of meeting April before the meeting, is not all community members know the resource available through the Sheriff's Office with the Crisis Response Unit. So not only are we trying to kind of mitigate the harms done to the disenfranchised and marginalized individuals in the community, but also the businesses and the community itself that's affected by some of this behavior. So we offered that support, and we're trying to champion getting the message out to more and more individuals through some of the spending of this opioid settlement dollar in terms of asset mapping, getting this information out into the community, so on and so forth. So to adjust the immediate need, the Crisis Response Unit of Oakland County, thanks to the Sheriff's Office, would respond to those incidents and help support that clinic in the interim before they're moved to a location that's better suited for that community. We can't continue to try to push this out into areas and ignore the problem if it's not being addressed at a root cause level. And we've talked, and I've heard already today about individuals that are unhoused and have mental health issues and have substance use. This is all the same issue. So as we support these initiatives, as we support it with infrastructure, as we support it with staffing, and also some of the real informed information we're getting from these drug checking machines, we'll be able to respond to those incidents in real time so that our community members don't have to rely on 911 and dispatch services and road patrol for those issues.
So the Crisis Response Unit will support the clinic. How? What are you gonna do today?
Well, can I just throw this to you? We have staff that are outside monitoring, right, these clients. We don't want clients just laying around, not getting the services that they need. In addition, we have staff members that are out looking in the alleyways, right, to ensure that if there are situations that they're assisting with those, right? I know there was a mention of a bench, right? That is a city bench, right? We have worked with the city to try to get it changed and moved, and we haven't been successful in that, right? So we understand and really are looking for ways that we can assist the clientele when we're there, right? And then also working with Steve and his team, the sheriff's team, when we're not located in the building, they can help assess and help with those situations.
So your staff outside of the building, are they there during the hours the harm reduction clinic is open?
We have staff that are monitoring, not every single minute, right? But they are monitoring the situation outside and looking at Kate, because Kate oversees that area as well. And so I just want to make sure I'm not saying
So
something incorrect.
define monitoring, what does that mean?
No, you have to remember, it's a very small team at the harm reduction office. This is not, there's 3 people working in that office. And so we utilize a volunteer mainly that comes, and he's really well known in the community. People really respect him. And so he's got that kind of the charisma to be able to approach individuals and say, look, don't do this out here. Don't sit out here. And he's the one that helps, but like pick up trash on the outside and just kind of look everything over and make sure that we're keeping it clean, being respectful neighbors.
So you have a volunteer there, is it during the time the harm clinic is open?
Of course, and he's not there 40 hours, right? So he's there probably 20 hours a week.
Okay. Commissioner Genzel?
Yeah, so I appreciate the services that you're thinking about offering, and moving clearly will be helpful long-term. As you're looking at it, maybe there's just even more practical things we could do, like some type of physical barrier between the properties. I don't know if the facility that we're utilizing, the landlord or whoever owns it, or the county might be willing to put up some type of privacy fence if the situation accommodates it. I mean, something like that. This area is gonna be a collector area. People going outside and saying, hey, move, shouldn't do that here, or even calling, services that are more available now than in the past. It's not gonna stop people from collecting there. And when the people collect there, they're gonna do things. So a physical barrier in some form or fashion may be a good short-term and longer-term solution if it's something that's possible.
We can definitely explore that, but, this is gonna be until September, so.
And maybe even before that, right? I mean, we're working with Connor to get in.
You could have a privacy fence put up next week.
I don't know, we have to look
Let's
at
find,
let's look at
maybe
the-
our city experts can tell us what.
Yeah, well, clearly it takes city permits and all that
Thank you for the
type of stuff.
recommendation. Yes.
Commissioner Powell?
Okay, so this has been a back and forth, especially with one of the neighbors that own business next door to the facility. I went and physically seen it myself. I understand and hear everything they saying. No privacy fence, cause it's like a strip. So at Lafayette Market Cross, it's a strip. No private fence, the buildings are attached to one another, so that can't happen. What I've encouraged our executive staff to go back to the drawing board and move the location, period. Reason is because I have been getting complaints from people who live at Lafayette Market, our mayor's girlfriend, and the mayor lives there. The mayor did, at one point try to watch things, and he didn't think it was a problem until his girlfriend moved in with him. And she has been monitoring it left and right. And she just said she sent a long paragraph to me of her feelings about this location. I've shared that with all of them, they know this. So for me, because of what's going on, and then two, that little area is finding out that we about to bring a whole clinic less than a mile away. And they like, okay, well, this is all under one hub. We're helping all people. So why don't y'all move it over there? So that is what some of the other business owners have found out. And now it's a collective group of them who are advocating for it to be moved and for it to, if we gonna move it to our clinic. I can't argue with them because technically our clinic is supposed to help everybody. So I told our health department, figure it out, but do not renew the lease, and we need to figure it out. So that is where I'm telling my colleagues where I'm leaving this, because there has been a back and forth with that. They have tried to put measures in, everything they said they are doing, however, it's still creating some type of anger or whatever in that community space right there. So that is where I'm gonna leave this. I do commend you all are doing a great job, but it's getting problematic. Also, the city they not approving no fence, and the bench is not being moved. Reason is because those benches was donated to the city. They are for the community to sit on, despite wherever you at on Saginaw, downtown. So the mayor declined even having that conversation of moving it. So that is my report from my district about the situation, and I would look to see how we move forward with this.
We need a parallel path while we're providing resources and support to people in need. We need a couple of people out there when that clinic is open to manage that area. Yes, oh, sorry.
Ken Briggs, I'm a Oakland County employee, but I'm stepping in the role, and I'm gonna just say I've treated over 30,000 individuals for opiate use as a counselor and a detox counselor. What does substance abuse look like at the end? It can be really look pretty bad in some stage. What they're doing at the end of it, when somebody's out of there, my mentee, 37 years old, used to shoot heroin and crack cocaine in his jugular vein, lost all his kids, now have them back, speaks in front of everybody to do it. It's a beautiful thing. So some of the ugly, and I grew up in Pontiac, grew up in Lakeside Projects in Pontiac. I know what it looks like, I know what it is, and I commend my colleagues on the opioid steering committee that we're trying to do something about that. But we're trying to make this a beautiful thing and from an ugly thing. So that's what I just had to say.
Yeah, it's needed. I'm not saying it's
Yeah.
not,
No,
because our
I'm not
community
arguing.
need it.
Yeah.
But we do gotta figure out another location. I'm tired of getting the calls, I'm tired of getting the complaints. And again, we are moving, it's walking distance to a clinic right around the corner, and I can't defeat that. Because now we coming off like we only helping certain people. No, our clinic is to service everybody. And I can't battle with how am I to battle with the businesses or people to say, well, ain't that what a clinic is? Cause that's how we selling it, that we're gonna help everybody. So why not just move the syringe, that whole location? Because it's a certain type of individuals that we are helping still in the all category. So that has been my battle.
Can I just say this too? I'm gonna bring back what I said earlier. We know, right now, it's the harm reduction clinic that is, it's being said that it's bringing people there, but we know, like, from history of other main streets, like, there's going to be unhoused folks, and we will not stop meeting and creating strategies for our unhoused folks, regardless of where the harm reduction clinic moves. In fact, we right now have a stakeholder group with, Commissioner Powell, myself, Megan Sellers, our health teams, as well as Steve. We meet on a monthly basis to create a strategy on how to create a support network for the unhoused folks in Pontiac. That will continue even after this harm reduction clinic moves, because we know that this is, homelessness doesn't go away overnight, right? So
The difficulty is harm reduction clinic lease is through September. We'd like it to move earlier, but what can we do now, today? Have your meetings in front of Saginaw Consignment Shop.
Yeah.
So my heart does go out to people. Addiction is a disease.
Yeah.
We help people with diseases, but we need to do something to help that Main Street now. I'm sorry, Commissioner Gershenson,
That's
you
okay,
wanted to.
so it is September that they're scheduled to move.
Yes.
Okay, so is it possible that we could allocate some money, I don't know if they have money, but to have more assistance, paid assistance outside?
Oh, I absolutely agree at the
So
minimum,
why aren't we
at the
just
minimum.
doing that?
But again, we don't have, I'll tell you, the grant that we receive barely pays for the money
Okay, so
that we,
I'm saying,
yeah,
do
so
we
don't
have
it.
money to address the immediate need? It would be through September. Clearly.
we'll take it.
Well, I'm saying, how much is it? We have special project money if we don't have general fund money. I mean, there's ways to address this immediately tomorrow.
I
And why don't we
that's
just do
imperative.
that? Is there a reason we're not
Yeah.
doing that?
May I suggest too, today, when I meet with the Main Street folks, I can also come back and talk to you all about what they are elevating. Maybe
I
that
get that,
helps.
but I'm looking at today. We're looking at today.
Right.
And we can put it off, but, you
We
know.
need something practical to help, because you're right. I wasn't aware of this until maybe 2 weeks ago, but it's an ongoing problem. And we can talk all we want about having strategic meetings and this, but what are we doing practically?
So
Really, have your meetings in front of the harm reduction clinic.
can I make,
Well, wait, just to support Medea and what she's saying and why she need to touch base with Main Street. Y'all may not know this, but Main Street just opened a office location down there. And they've been having more of a presence with our staff from Main Street and the businesses collectively. And I think that will help her just get a little bit more idea, or even if with Main Street people could become these volunteers if we find the funding type stuff. So we can pose the questions to her what we need answered to see if we can do a collective thing. But overall, I'd still think that for the temporary fix, great, but we do need to look for another location.
so when is your Main Streets meeting?
Tonight.
Tonight.
Today.
Yeah.
So we have a meeting next week. So can you get us the information we need so that we can take action at our meeting, next?
Caucus, you talking about caucus?
Yeah,
Or
but
board?
A board meeting.
board meeting,
Right, okay.
so we can take action quickly on this.
Can we make a recommendation on like the type of individual or employee
Of
that
course,
we just
that's
wanna make
your-
sure it's somebody
of
relatable
course,
and
I
someone
know
that's-
nothing
no, that's
about
your
that.
choice.
Bring that
That's-
recommendation, we'll make sure we give
You
that to you.
come to us and we'll take action.
Thank you, Commissioner Cavell.
Well, you know, just to keep the conversation going, we could make an amendment for $200,000 if we pass this out. Then we can either take that to finance and the full board or not. And they're having the conversation anyway, so everything could be firmed up. So I would make a motion to put $200,000 amendment to this to help with the transition costs.
I think 200,000 is too much to pay
Yeah,
one.
it's not substantial.
Oh, it's not a person, it's all the
Out
stuff they
there.
need. They only have 3 staff.
I'd like more details before we head into that one.
So would I.
Are kind of tight in that
It's very
space
tight
now.
space anyway.
Honor, as we've been talking about their new headquarters, they have offered to be able to provide space there for us, and we very much accepted it. So we're looking at a temporary space that we can be there. You know, if it's before September, we're ready to go. But again, they're in the midst of dealing with
Construction right now.
construction and
So they're building it
DOT
out.
right now, so they're just
Is that
And just
still
so
Deb
you know-
Hilmer? Is she still?
Deb Brinson.
Deb Brinson.
Yes.
And just so you know, you kind of familiar with that area.
Yeah, you got
It's
Lafayette
ATAP,
Market.
well, ATAP used to be a school, so you know how you go around the curve on Woodward? It's that big building that Honor is picking up. So that's why I thought, because it's such a school and bigger space, maybe a portion of it, one of the ends, of course, could accommodate what we're trying to do.
So it's a little bit of Honor not being prepared because they're working on a build out, but it's more so us saying, oh, well, we've got this contract and the date stamp September.
And again, we were looking for a bigger space prior to this, right? We wanted a bigger space, and the landlord didn't have a bigger space, and Deb said, hey, well, we have this big space, can you please come and join us?
So just maybe another option is to ask Deb, what are the possibilities to accelerate the move? And I get we have a lease, but you can break leases, you can pay a cancel it. I
And
mean,
I'm
there's.
sorry, I'll let you know, we're working on that. So Deb says if they even have a temporary space for us, right, maybe it's smaller, but at least that we can get out of our lease prior to, we're willing to do that. So we're kind of waiting on
Because we're
Honor.
desperate for space too, I
Yeah.
mean, we have a lot of clients, so we,
You want us to
it's
call and
in our
pressure?
interest to.
I think it's Lee, it's not her. I think she's
Yeah.
willing for us, they're trying to do as quick as they can, so, yeah.
Commissioner Gershenson?
So can we vote on all this with the understanding that, okay.
Cavell had a question first.
Commissioner Cavell.
Yeah, so I see that you're upwardly classifying a position, but you have opioid settlement dollars and you're also then using general fund money. Why not first make a new position unless you don't need the public health nurse 3 position? And then second, why use general fund money for the next 3 years if you have $5.2 million?
Just trying to be fiscally responsible, yeah, we know we have some nurses currently in the organization that could fill this role, and so we were using it as an opportunity to just, use one of those positions.
And the last question, this epidemiologist that we funded last year using opioid settlement dollars, that's an epidemiologist just for opioid clients?
She does opioid related OFR, right?
Substance use disorders.
Yeah, she's right behind you.
Right here.
Hi.
Hey, cool.
In the flesh.
Yeah.
Thank you.
Okay, so I'd like to go back to, let's vote on these. And with the understanding that you're gonna, oh, I'm sorry.
Sorry. Commissioner Erickson Galt.
Thank you, Chair. Charlie's question brought up a question in my mind. Unlike the ARPA funds, we don't have like a sunset date for spending these opioid settlement funds.
Correct.
So we could, I just, this is more of a comment, I'm hoping we're looking at this as more of a long-term funding situation as opposed to like dumping all the money, you know?
Exactly.
Okay,
This
all
is
right.
why we're coming back to you with strategies, because we wanted to be intentional about where we spend this money.
I appreciate that. And I appreciate also the looking at how we can fund some of this both with the ongoing money that we have in our general fund and supplementing it because that will help it stretch out longer. Great, thank you.
Commissioner Taylor?
Yep, real quick, and this is gonna go to a whole nother topic, about the website. I was just concerned, are you doing like a third party? Because I know it's a website, but if everybody have access, you gotta have maintenance, upgrade, and you don't want anybody just going, from what I heard, you're gonna allow people to go in and make changes, like the phone numbers, addresses, and things like that.
Yeah,
Are there
so we
verifying
have
it?
an opioid settlement committee website that sits on the county
She's talking
website,
about the
yeah.
dashboard.
And then the dashboard is actually gonna be consumed in another application that Health is purchasing. So it's paid by a grant, right, that we have, and so that'll be taken care of by that. We're just gonna put this data in the application and website that's already existing, that's paid for another grant.
But to be able to update your information, if you're a provider, you'd be given a login.
Yeah.
Right,
So it would be, there'd be quality control on who could update that information.
That's all I'm asking for is the quality and the
Yeah.
controlling piece.
Yes.
And who's gonna be responsible for maintenance upgrades and that kind of stuff, because you don't want that open to anybody.
No. Correct, and
Because
so.
you could get an address or a phone number to someplace you don't wanna go.
Exactly, and
Okay.
so we're approaching it through two different mechanisms, either letting the providers do it themselves. We also had a meeting with Oakland University to explore how we might be able to take advantage of their capstone projects and their internship program to help us with that quality control.
And also our Nurse on Call. So they currently maintain their own directory of over 1,000 resources, right? So they'll also be using that to monitor and make sure things are correct.
Thank you, and great information. I appreciate all of the time and everything that you're doing and presenting of the information and letting us help our county commissioner.
Thank you.
That's all I have.
Would you prompt the vote?
Marcia.
Oh, there's Marcia, okay. I was gonna say,
Oh.
Marcia.
I was like-
Marcia wasn't the vote for it, but she wasn't even here.
You have 7 yeas, 0 nays.
Motion carries. Thank you.
Thanks so much.
I know I'm not unsympathetic to both sides. I've been a drug and alcohol counselor for 10 years in my past. So I have seen the failures and the successes also. But traveling that path, I do not wish that on a business owner. All right, our last item is from the prosecutor's office. It's an interlocal agreement between Oakland County Health Network and Oakland County for a behavioral health and justice liaison. This would provide support and resources to individuals facing potential legal charges who may benefit from mental health and or substance use intervention. Who would like to make a motion? I have a motion by Commissioner Taylor, support from Commissioner Gingell. And we have David here to speak to this item. Welcome.
Good afternoon.
It is afternoon.
Thank you for allowing me to speak this morning or this afternoon. This is a really important position in our office. It's a liaison from the Oakland Community Health Network who we had for about a year and a half, who was vetted here in the office. And what you all may or may not know is that a lot of the folks who come into the criminal justice system have underlying mental health issues. But there are also a big group of juveniles who wind up in the system whose families really need services and support. So the classic example is you might have a 11 or 12-year-old who is physically misbehaving at home and has done so repeatedly. And eventually the family is frustrated, they don't know where to turn, and they wind up calling 911 and law enforcement comes out. And the question is, what do they do? You have a grown 12-year-old who's assaulted a family member, law enforcement doesn't feel comfortable simply leaving the person there. On the other hand, a criminal justice response is not appropriate. That's not the answer. What we found in those cases is a lot of times families have not accessed some of the available services because they either didn't know they existed or didn't know how. So while we have our liaison, we had 250 juveniles who were served. Most of them were not quite in that predicament, but some of them were. And it proved extremely valuable for the families. We were kids not who be criminally charged, but who did need help. And so we want to continue that. We were sad to lose Kenisha, who was embedded here, and we were pleased that this was included in the budget last year, and that's what we're asking all to recommend the approval of the local agreement that will allow that liaison to come up for us.
Thank you. Any comments or questions? All right, would you prompt the vote, please?
Commissioner Gershenson? Oh, she's not there. Okay, you have 6 yeas, 0 nays.
Motion carries. Thank you. Thank you for taking the time to be with us.
Yeah, thanks.
We've arrived at our last public comment of the day. Is there anyone from the public wishing to comment on anything? You would come to the head of the table. You're welcome to have a seat. State your name and community, and you have 3 minutes.
Okay, round 2. I think I got most of it out, the first one, and I've heard the big question of where it's moving, so that's wonderful. And I wanna thank Kristen Nelson, the Waterford Commissioner, that actually finally called me to tell me after all of this that they were moving. As you know, downtown Saginaw Street and the Huron Corridor are a partner with Main Street America and are working towards becoming accredited. This should never have been there, those type of businesses. The table is a 2.523 community service facilities are not permitted, so I'm not quite sure how that happened, okay? But the businesses downtown need to be assured that Oakland County and the clinic are responsible for their client actions, especially when they're hanging outside drinking alcohol. Hire a security guard, do something, okay? Main Street does not have their money yet from the ARPA funds for Pontiac. I just heard about it 2 days ago. I doubt they still have it. It's all volunteer basis right now. So I highly doubt, I don't know what you're gonna get out of the meeting, but you know. The 43,000 funds for the FTR machine, I had questioned that because the summary sheet states it will be used to conduct real-time analysis of drug substance and facility accurate of rapid overdose response and provide timely targeted intervention and education around the drug supplies. Those guys are the ones that should have the machine, because what this means are that the clients are gonna be able to bring in their substance to the clinic and get it analyzed. There's already a cartoon of this on the whole opioid crisis online. So no, I don't think people should be able to just walk in and get their substance. It should maybe be with, you know, ambulance, someone like that. Okay, and this clinic should never be allowed for clients to shoot up ever. Just wanna put that out there. I also thought that the resource directory project was a little bit different. I thought it would help create data recurring use of syringes, maybe those that get help and recover, and so that we can have some of those wonderful ideas of who, you know, tracking all of that and have some data on that. Because the ones that I looked at only in the Michigan Syringe Service Program shows from 19 to 21 and 21 to 24 syringes distributed, went from 3.8, and now in the last 3 years, over 15 million syringes were given out. Okay, I understand the opioid settlement funds. I believe they should be given back to those who became addicted, lost their jobs, families, and homes. Okay, and counseling for veterans, and maybe flyers for meetings for existing groups, also working with the substance abuse, some of these other things. I hope the committee is looking towards that. okay? I also like the idea of this recovery housing investment program. That was a huge one on their site. So I did look into a little bit of this stuff to be a little bit more on both sides here. And I'm just here to share my experience with the clinic, some thoughts on the opioid settlement funds, and ask that the Board of Commissioners be cautious about the funds, how they're used, and don't let our businesses be affected negatively anymore. Thank you, April Hawk.
Thank you. Is there anyone else for public comment? Seeing none, public comment is closed. Is there any other business to come before this committee? Seeing none, this committee is adjourned at 12:10. Thank you.